As I reflect on the past year, two words come to mind: resilience and motivation. As CEO of Nashville General Hospital, I am proud to boast that the Nashville General team is motivated to carry out our commitment to the community on a daily basis. In the midst of facing multiple formidable challenges that 2021 brought, our team has consistently demonstrated a tremendous amount of resilience. In 2022, we will deliver even more to the Nashville community through our expanded services, which you will learn more about tonight. We're excited that you have decided to join us for Nashville General Hospital's 2022 Town Hall meeting.
Hi, I am Dr. Shandana Fagans, Chair of Metro Hospital Authority Board, and I'm happy to be here with you today. I've said it before, and I'll say it again. Nashville General Hospital is one of the truly essential institutions in our city, and we are committed to keeping the momentum of our success. It's hard to believe that it's been almost 24 months since the tornado ravaged our city and the start of COVID. Nashville General Hospital played an integral part of the efforts to combat the pandemic and care for our community through testing, vaccinations, and addressing food insecurity. We have been able to measure our success. A few noteworthy successes include the hospital significantly improving the patient-payer mix while still caring for all Nashvillians regardless of their ability to pay. These positive outcomes are made possible by controlling costs and focusing on improving patient outcomes and their care experience. In March, the Hospital Authority Board approved the 2020 fiscal year audit. For the third consecutive year, Nashville General Hospital received a clean, unmodified audit opinion, reflecting sound fiscal practices, stewardship, and accountability. Nashville General Hospital's Dr. Robert E. Hardy Cancer Center celebrated their 80th anniversary of continuous accreditation by the American College of Surgeons Commission on Cancer. The Commission on Cancer recognizes cancer care programs dedicated to improving survival and quality of life for cancer patients through standards that promote cancer prevention, research, education, and monitoring of comprehensive quality care. The hospital's success is also evident with the expansion of the Nashville Healthcare Center Midtown and the new NHC Bordeaux location, which is under construction. We are excited to share that the board unanimously voted to complete due diligence towards building a new facility for the Nashville community that will better serve our patients, physicians, and medical students. Nashville General Hospital is a hospital for every Nashvillian. If you haven't tried our services, trust me, we're worth a look.
Greetings, I'm Councilmember Erin Evans, and this evening I join you as the Chair of the Public Health and Safety Committee. Nashville General Hospital's mission is to improve the health and wellness of our Nashville community by providing equitable access to comprehensive, coordinated, patient-centered care. This is essential to the health and well-being of Nashville-Davidson County. The hospital has maintained a strong commitment to addressing the healthcare needs of all Nashvillians, regardless of their ability to pay. Since 2009, Metro government has offered a healthcare incentive program that allows Metro employees, pensioners who do not have Medicare as their primary coverage, and covered dependents to receive healthcare at Nashville General Hospital for no or low out-of-pocket expense. This program is a win-win for our city, Metro employees, and Nashville General. Metro government enjoys lower price costs at NGH for the same high-quality healthcare services received elsewhere. Metro employees save money through eliminated or heavily discounted copays and deductibles and don't have to consider deferring their healthcare until they can afford the costs elsewhere. The incentive program helps Nashville General see more insured patients, which helps offset the cost of the charity care provided under their charter as the city's hospital. To all Metro employees, I encourage you to tap into these resources that are available to you. The hospital has served our community for the past 132 years and will continue to be a beacon of light for many more to come.
Hello, I'm Dr. Joseph Webb, CEO of Nashville General Hospital. It's my pleasure to welcome you to our 2022 virtual town hall. Thank you for joining us tonight to get updates about Nashville General Hospital. Before I start, let me make a few acknowledgments. First, the dedicated staff of Nashville General who show up every day with a desire to serve our patients and community and provide compassionate health care. The Metro Hospital Authority Board of Directors, all the doctors, residents, and administrators at our partner, Meharry Medical College, who we coordinate with daily to deliver on our mission to support tomorrow's caregivers. The mayor and his administration, and Metro City Council members. Nashville General is an important asset to the Nashville community, providing access to coordinated patient-centered care and multi-specialty centers regardless of a patient's ability to pay. I continue to be proud of the outstanding accomplishments this team has made over the past 7 years, including improved patient outcomes, national recognitions, and reaccreditations and expansions of services for the community we serve. Here are members of our executive team to tell you more about our accomplishments.
Good evening. I'm Bruce Nairmore, Chief Financial Officer at Nashville General Hospital. Last town hall, we spoke about our volumes rebounding significantly in fiscal year that ended June 30, 2021, and that growth has continued through the first 6 months of fiscal year 2022 as well. Inpatient admissions are 16% higher than this time a year ago, and patient days or average daily census are up 15% as well. Our emergency department visits have started to rebound, up 8% from a year ago, still well below pre-COVID averages, and nearly 90% of our admissions come through our emergency department. Our clinic volumes grew 30% plus last fiscal year and are up 17% this year so far. They did drop a bit in the holiday months of November and December most recently. 22,454 visits compared to 19,110 last year through 6 months. Our cath lab case volumes continue to increase, up 58% year over year to 370 cases versus 218 last year. Our self-generated net patient revenues reflect the busy fall volumes and are 22% higher than budget, helped by some COVID HRSA claim payments for the uninsured, but a continued sign of strength here. The additional revenues are absolutely necessary as the costs of care are rising rapidly in areas like pharmacy, contract labor, in nursing and respiratory. In fact, our expenses are up 14% compared to the same period last year. And I think everyone knows prices are going up, groceries, rents, gasoline. We're not insulated from that either. But thanks to support from the mayor's office and the council for the current year, we've been able to navigate those issues thus far, absent the COVID CARES Act award that we got last year. We have challenges ahead to maintain and improve care to our community. We will be presenting our budget to the mayor in early March, along with requests for desperately needed capital to replace dated equipment. And we need your support to help tell our story. Thank you.
Hello, I'm Dr. Deanne Bullock. I'm the Chief Medical Officer here at Nashville General Hospital. I want to thank you today for taking a few moments out of your day to join us for our town hall this year. There are multiple medical and clinical decisions that are coming down the pipeline that impact you and our patients over the next year, and I want to talk about a few of those today. The biggest is the COVID impact. As cases continue to wax and wane, fluctuations in the number of cases continue to strain our resources at times. There are multiple nursing and staffing shortages, not just here, but regionally and nationally. We continue to work with multiple staffing agencies and are being creative in doing things differently to maintain our staffing numbers for our patient care. We want to also focus on continuing to stay healthy and taking care of our patients. We want to support our providers and our staff and allow them to have all the resources needed to maintain stable mental health and continue to work to the best of their ability. COVID is obviously here for a long time, and what that has done, it's allowed us opportunities to expand and do new ways of doing things. Telehealth is probably the biggest one that everybody is well aware of, but we continue to explore options to continue to maintain treating our patients in the most appropriate manner. Many people have already known about our trauma application being submitted. The trauma application was submitted to the state back in August. There's continuing to be much background work that continues to be done. At this point, we are waiting on a state visit for a provisional designation. We expect this to happen probably in the next 2 to 6 months. After that, The provisional designation will last for approximately a year, at which time the state will revisit for a final designation. Behavioral health is another aspect that we want to spend a little bit of time on. As we continue to expand services, one of the specific initiatives will be the whole health of the patient, focusing on behavioral and mental health. While the need has always been here, it is never more prevalent than what people are going through right now and the challenges they have gone through over the past year. We want to continue to meet our patients' needs, and with that, we have integrated a full-time licensed clinical social worker into our clinics. One of our nurse practitioners will now have the ability to specialize in mental health treatment, and we will have the support of a psychiatrist to support these two providers as well as see their panels of patients. Additionally, the emergency department has an on-site mobile crisis counselor that is now stationed in the ED to better facilitate expeditious disposition and placement of our patients experiencing acute mental health crises. A few other medical changes that are occurring during 2021. We will continue to grow and build our existing service lines to expand clinical access options for our patients. There is significant need in our cardiology and GI service lines for patient access, and we will additionally be opening up our Bordeaux clinic location mid-spring to provide that additional access for existing and new patients for both primary and specialty care, as well as some additional imaging options.
Hi, I'm Veronica Elders, the Chief Nursing Officer here at Nashville General Hospital. Like all hospitals in the country, staffing has been a challenge for us, but we are currently recruiting nurses in this tough time. Nashville General is a great place to work. We offer a small community hospital setting, a family environment, a very diverse patient population. We also have lower staff-to-patient ratios than the larger facilities. We have a nurse residency program for newly graduated nurses and are currently offering a $5,000 sign-on bonus for new RNs.
Hi, my name is Mark Brown, and I'm the Chief Operating Officer here at Nashville General Hospital. And I'd like to talk to you today a little bit about our commitment to patient quality from an imaging perspective. Phase 1 of upgrades to the medical imaging department included a 128 Fuji CT scanner, a digital mobile x-ray unit that allows us to go throughout the hospital taking photographs of patients, and we're in the process of installing a new interventional radiology suite that will allow our interventional radiologist, our vascular surgeon, and our interventional cardiologist to perform procedures on patients. At our new location in Bordeaux, we're planning on providing a state-of-the-art imaging center that would include a 64 CT slice scanner that provides better imaging quality. We'll be able to do cardiac scans at that location as well. At that location, we plan on providing a MRI, a 1.5 Tesla unit that will have quad technology associated with it. We're also planning on opening a digital x-ray unit, sonography, or what you commonly known as ultrasound, that will be provided at that location, and a digital mammography unit. All this equipment will allow for us to provide state-of-the-art imaging at our Bordeaux location, which has no imaging capability in the community, and the residents of Bordeaux will be able to stay within their community to receive their imaging procedures. We're excited for our cardiologists, our radiologists, and all of the imaging equipment that we'll be providing at our new location in June of 2022.
Hi, I'm Jeff Hardwick, manager of Nashville General's Community Pharmacy, and we'd like to be the pharmacy of choice for you and your family. We're a full-service pharmacy located on the first floor of Nashville General Hospital and even offer convenient curbside pickup. We're open to not only the NGH and Meharry patients and staff, but to all members of the surrounding community. It's an unfortunate truth that other pharmacies in our community, the level of care has fallen quite low. If you're tired of things like waiting for hours for your prescriptions or even days, prescription prices costing you an arm and a leg, being left in the dark when insurance problems arise, or simply long hold times and not being able to speak with your pharmacist in a timely manner. At the community pharmacy, we're raising the bar back to where it belongs. Our knowledgeable licensed pharmacists and technicians are here for you, working alongside your doctors to help you navigate insurance, alleviate high drug costs, help you obtain prescriptions in a timely, affordable manner, and perhaps most importantly, do so with the respect that you deserve. True to the mission of Nashville General Hospital, we're committed to providing health and wellness to all Nashvillians. By providing essential medications to patients at an affordable cost, we want our patients to get healthy and stay healthy. So the next time you are on site, feel free to stop by. Meet myself, Jeff Hardwick, Camille, or Donna. We would be happy to discuss your pharmacy needs and become your pharmacy of choice.
The Congregational Health and Education Network, CHEN, was founded by Dr. Joseph Webb in 2017 in Nashville, Tennessee. The mission of CHEN is to reduce the health disparities among Nashville's African American community by elevating education attainment and health literacy through faith-based partnership. The 4 pillars of CHEN are education attainment, health literacy, access to health care, and membership development and maintenance. It is within the framework of these 4 pillars that we seek to continually meet our goals and fulfill our mission. In the past year, CHEN has produced the Faith in the Midst of COVID series with 4 virtual events in conjunction with the Ad Council, provided $200,000 in mortgage and rent assistance to CHEN congregants affected by COVID, hosted 24 events at member churches and 1 at Nashville General Hospital during the COVID-19 pandemic, administering just over 1,500 shots to the community, while also providing premier access to the vaccine to the elderly. In addition to these events, we've also established a partnership with the Nashville General Hospital School of Health Sciences to provide educational opportunities for congregants. We have also provided concierge access to healthcare services at Nashville General Hospital and Nashville Healthcare Center.
When I found out about CHEN, I was very excited because our church, Christian Journey Fellowship Church, is located in North Nashville and not far from Nashville General Hospital. And so when I found out about the Congregational Health Education Network, it made sense for our church to join. And then once I found more information about the actual program, how it functions and what it does, I approached our pastor and he was excited to join as well. Right when the church joined CHEN, I was in the midst of finding a new primary care provider and talking with Kristen and accessing the healthcare services through CHEN at Nashville General Hospital. I was connected with a great provider who is now my primary care physician. And so not only was I blessed to take part and be a member of CHEN, but I also found a doctor who I connected with, who understood where my journey and my healthcare journey was, and who I was as a person. And so I was able to find those services through the Congregational Health Education Network. CHEN has been a game changer for the Nashville community, especially the faith-based organizations that reside in the community near Nashville General Hospital and far. We've been waiting on a network of churches to provide health education resources, to bring churches together, organizations together who can provide information, access to resources and material to congregants who may otherwise not have it. And so joining CHEN was necessary. But staying with CHEN will be our desire, and what we want to do is encourage other churches to join CHEN because of the connections that we make and the network that it provides, but also the access to resources and health education and information that it provides to everyday, ordinary Nashvillians who want to stay and be healthy. Nashville General Hospital is sorely needed in this community. We love the hospital, but also we understand that the resources and the services provided here are necessary for our neighbors and our residents and our community members to stay and to live healthy with the resources that are provided and the services that are provided here every day at Nashville General Hospital. So it is my hope, it is my desire that we can continue not only the program, not only the Congregational Health Education Network, but the wide range of services that are provided by Nashville General Hospital. I think that the services will only continue to grow, and access to those services will grow through programs like CHIN and those just like it.
To fulfill the Nashville General Hospital's mission and vision to improve the health and wellness of Nashville, one neighbor at a time, we launched the Food Pharmacy in 2019. The Food Pharmacy addresses the food insecurity of NGH patients through the provision of no-cost, nutritious foods. Originally built on the premises that food is medicine, the program started focused on disease self-management of our cancer patients, and it is currently available to all of our patients who are food insecure. Healthy and fresh foods must be accessible for our patients and community to improve health outcomes for all. Regardless of how a patient enters our health system, they are screened for food insecurity. If they have a chronic illness or cancer, patients receive a food prescription just as they would any other medication. With the help of a dietitian, patients are given shelf-stable and fresh produce and learn what they need to eat and how to prepare the food to achieve their best health outcomes. In addition, patients are connected with a social worker to address the food insecurity and other social service needs that impact their health. In 2021, the Food Pharmacy served over 1,100 patients. This is an example of how Nashville General fulfills its mission in action.
Hi, I'm Frida Player-Peters, Metro Nashville School Board member representing District 7. Nashville General has proven to be an enduring symbol of hope and compassionate care in the community. As many of you remember, prior to becoming a school board member and my time working in the mayor's office, I served as the political director of the Service Employees International Union Local 205, which represent Metro government and school support employees. Nashville General's Metro Employee Incentive Program eliminates the cost of copays and deductibles for primary, specialty, lab, and emergency care services fulfilled at Nashville General Hospital or Nashville Healthcare Center clinics for all Metro employees, pensioners, and their dependents who are covered under the Metro Medical Plan. Nashville General is essential to Nashville-Davidson County as they serve and maintain their strong commitment to addressing the healthcare needs of all Nashvillians. To Metro employees, there is zero cost to participate in the Metro Healthcare Incentive Program, and there's no need to sign up. If you currently have a Metro Healthcare plan, you are eligible now. Take advantage of these well-deserved cost savings. I do. I go to Nashville General for my mammograms, and I appreciate the quality of care I receive. Tonight, we've had the opportunity to hear the good things and the growth at Nashville General. I continue to support the hospital, and I ask you do too. Have a good evening, and remember, there's nothing important than our good health. It's our principal capital asset, and maintaining good health should be the primary focus of everyone.
As you've heard tonight, Nashville General Hospital continues to achieve outstanding accomplishments while looking forward to many more. None of this would be possible without you, the dedicated team of employees working together daily to save lives, the support of Metro government, and to the community for trusting us with your care for the last 131 years. My sincere thanks and appreciation to you all. And for those who have not yet used our services, I encourage you to do so. Nashville General Hospital, we're worth a look. All right. Well, that was a lot of information. Thank you all for joining us tonight. You've heard quite a bit on Nashville General Hospital and the things that we've done and that we are doing. But now we want to hear from you. So get ready with your questions and your interactions. This is live, and I'm going to now turn it over to our moderator. She's ready to go. Chief Marketing Officer and Public Relations, Ms. Sherry Gibbs. Sherry?
Thank you, Dr. Webb. Thank you very much. We do have some questions, and the very first question is one that we get a lot, and that is people are really curious about how many patients does Nashville General see annually. Dr. Webb, would you like to take that one?
Sure. We're busier than most people think. We see 45,000 outpatients a year and visits, and that does in the last year, and that represents a 22% increase over the previous year. So we're busier and getting even busier.
All right, thank you. Another question that people frequently ask is around our budget, right? And the money that the hospital gets from the city of Nashville. So I'm going to ask you, Bruce, our Chief Financial Officer, how much of the hospital's costs are typically covered by Metro Nashville's funding?
Sherry, the subsidy that we receive from the city is vitally important. It has varied a little bit, but it averages from about 38% to about 42% of our annual budget. And that pretty much aligns with the uninsured presentations in the hospital. Somewhere about 40 to 45% of the patients that present into our clinics or hospital are completely uninsured, and that's the reason that we're here, is to take care of the people that don't have those other options. And then we backfill that with the insured patients that we see for the other 60%. So that's our job, and I think we do a pretty good job of lining those up.
That's really helpful to know. So can you tell the public how much revenue does Nashville General generate annually?
Yeah, well, there's a couple of areas where we generate our own. In 2021, last fiscal year, we generated almost $40 million of collections from our own insured work. This year that we just completed, 2022, our fiscal year, $52 million. So a $12, $13 million increase in what we generated from patient collections. But we also get about $16 million a year from federal and state sources because we are a public safety net hospital. So when you add those two together, we produce about $70 million roughly as a public safety net hospital here in Nashville. And then Metro provides the balance of that through the subsidy.
Thank you for that. We'd like to know, we'd like to get some feedback from the community so we can better serve you. So this evening, we invite you to take a brief survey. Your responses will help us to determine what services, health services to bring to the North Nashville area and beyond, and it'll help us prioritize the community's preferences. So there's a code on the screen, a QR code on the screen that you can link to, and it'll take you directly to the survey, or you can look in the comments and click on the survey link in the comments, and that'll take you to the survey as well. All right, let's get back to some questions. Dr. Bullock, our Chief Medical Officer, you mentioned throughout the presentation that you talked about COVID. Obviously, we have had to adjust our operations to accommodate this global pandemic. So what have been some of the biggest impacts for the hospital from COVID over the past 2 years?
Thanks, Sherry, and thanks for joining us tonight. I think pretty much any hospital will say that the biggest impact from COVID has been around how we staff the hospital, staffing in the nursing areas and the ancillary areas. We haven't been as affected in the provider spaces with nurse practitioners and physicians, but staffing has definitely been a huge challenge with hospitals and healthcare organizations across the nation. Also, some of the challenges is just how we've adapted to meet patients where they are. We've recognized that there are a large amount of behavioral health needs in our patients, whether it just be for simple therapy, people just feeling isolated, to true mental health disorders that need treatment, people not being able to seek the treatment that they need or not having access to it. So those are two or three of the biggest impacts. And then obviously with anything else that we've alluded to previously is just the cost around supplies, the cost around labor, the cost around just everything that goes into healthcare, just like our regular cost of living in the grocery store and gas on a daily basis. So those are the things that have impacted us the most.
Thank you. I have another question. How can a patient get or receive a caseworker at Nashville General? Who might want to?
That would probably be Veronica.
Okay, thank you for that question. And so that would be dependent on your primary care clinic that you see. And so once you come in for your visit, we are happy to assess and assign you one at that time based on what your need is. And so whether you're visiting the internal medicine clinic or the Nashville Healthcare Center, our representatives there can assist you with finding that person to take care of whatever it is that you need.
Thank you, Veronica. And Veronica is our Chief Nursing Officer. I'm actually going to come back to you, Bruce, because something that you mentioned in the video, you talked about the need for capital. Can you talk about what might some of those capital needs be around the hospital?
Sure. Sort of the big ones are, we need a replacement electronic health record, both for the hospital itself as well as for our ambulatory clinics. Those are primarily subscription models now, but they do take a lot of dollars and resources to implement the new program. So that's probably one on the list. Then there's patient monitoring. We are in the process of replacing some of our patient monitoring equipment in the hospital now, but we need to update broadly around the hospital. Our nurse call system is quite old. We've been deferring it for a while because it's a very involved process, and we may in fact move to the new hospital, and we would leave all that behind, potentially the wiring and cabling in the process. And then our OR and our endoscopy areas definitely need updated equipment and instrumentation. So if I was going to tell you, those are the areas where we probably need the most capital.
Okay, thank you. Speaking of Mark, the next question will be for you. We've talked about opening a new clinic in Bordeaux. Can you talk about when will that clinic be open and what services will be available in that new clinic?
Okay, thank you, Sherry. So the clinic in Bordeaux is scheduled to be open mid-August. And as you know, construction, we try to pin down a date. And so we heard several dates throughout the presentation. I think that was in April and I said June. And now it's going to be August. Mid-August is the target date for the opening of the primary care clinic that will be establishing out in Bordeaux community. We are planning on providing after-hours care. We're also going to have our specialty care out there. So specialty care will include general surgery, podiatry, cardiology, and orthopedic services, and urology services at the new location. We also plan on opening a new imaging center that will house MRI, CT, radiology, ultrasound, and a 3D digital mammography unit. So all that will be at our new clinic at Bordeaux. That will be and the imaging department is scheduled to open mid-October. So by the late fall, we should have all our services up and running at the new Bordeaux location.
Okay, thank you. Someone actually asked, what is the exact location in Bordeaux? And I have it here. I don't know if you have it memorized. No, I do have it here. It's 4007 Clarksville Highway. Yeah. So right there on Clarksville Pike in North Nashville, across from the library. Across from the library. So it's in a very convenient location, and we do hope that the community will come out and visit us. Certainly come take a look and utilize the services. As Mark mentioned, we will have a variety of specialty services as well as primary care and outpatient imaging services will be coming online in the early fall. So certainly stay tuned to our website and our Facebook page. We will keep the public informed about our progress on opening that new clinic, that new location. Speaking of new locations, Dr. Webb, we had a question about the hospital relocating, right? So the question was, why is the hospital considering moving locations? Why not renovate where you are?
Okay, well, thank you for that. And just as a side note on the location of the clinic on Clarksville Highway, it is also right across the street from the Kroger supermarket there. So easy shopping and healthcare, fresh fruits, vegetables, good food, all right there in the same location. So easy to find. As far as the new hospital, first of all, just want to say that so the lease on this building will expire 2027. So that means that we have to make a decision. You heard the board chair, if you tuned in at the beginning of the session, you heard the board chair comment on their approval to seek further due diligence on building a new facility. And so why would we do that? We've looked at the comparative analysis from a repair and upgrade standpoint, and what we found is that what we would have to put into an existing structure that is really outdated, and what it would take to build a new facility, the economic side of that goes towards building a new facility. We would really have to retrofit to a large extent this building. The issues around power and electricity and the costs associated with that, energy costs, would also contribute to that position of moving to another site to build a state-of-the-art facility. So there are all kinds of economic advantages, and the hospital would be owned by the city as an asset instead of the hospital being owned by another private entity. So it would be, again, an economic benefit to the city as an asset, and plus the care that could be delivered there in a hospital that would be more suitable towards a state-of-the-art facility, which is in hospitals is more on a horizontal build than the current building, which is difficult to navigate in a lot of ways on a vertical build. So there are a number of reasons, probably too many to cover here. We will be producing more information on that in the future. But those are the basic reasons why we would consider moving to a new facility as opposed to remaining here on the site.
Thank you for that. We have a question about staffing. they're asking, where are the greatest staffing needs within the facility? Perhaps Veronica and or Bruce can answer that.
I can take that, Sherry. Thank you for that question. So our greatest staffing need right now is in registered nurses and respiratory therapists. That is I'll say a profession that has been changed. We're year 3 in the pandemic, and there was nursing shortages and respiratory therapy shortages prior to the pandemic. So we are recovering in those areas currently at this time. So those would be the greatest need. I also saw the question about the average staffing goals. And right now, so our nurses are in a 1 to 4 patient ratio, which you can't find anywhere in the city. And so one of the reasons we've established that trend is we want kind of personalized boutique care when you come and you're admitted here. And so those are our staffing ratios in med surg, and in the ICU, you're at a 1 to 2. But currently right now, we do need some ancillary staffing support, but RNs and respiratory therapists are our greatest need.
Hey, Veronica, could you, just for comparison's sake, could you share what you said 1 to 4 ratio? What
Yes,
is the
sir.
average hospital? Is that 1 to 6?
1 to 6, 1 to 7 on most med surg units around the city. In ICU, it's 1 to 3, 1 to 4.
And that
Yes,
means one nurse to 4 patients versus 1 nurse to 6 or 7 patients.
Yes, sir.
To get more attention. Just want to make sure that the average listener who's not in the healthcare business understands what you're really saying.
Yes, sir.
In terms of quality of care that's administered by that ratio of 1 to 4 versus having to take care of 7 patients. You can
Yes, sir.
administer more hands-on and, as you said, boutique care to that individual. So thank you for bringing that up.
Thank you, sir. Thank you, Sherry.
Yes. Okay. Additional questions. Someone asked, how often can a patient go to the food pharmacy?
I can answer, Sherry, I'll take that question.
Okay, perfect.
Yes. So the patient, in order to go to the food pharmacy, will receive a prescription, a written prescription from a provider. And really, it depends on which services they're coming from as to how long they can go. So if we have a cancer patient that's getting a treatment, a cancer treatment, they may be on there depending the length of their treatment, because the course of action would be to ensure that the patient doesn't lose any weight during their treatment, so that way they can maintain their treatment regimen and get to the end of that regimen by maintaining their weight. A patient that's coming out of primary care may only be in the food pharmacy for maybe 8 weeks time frame. And then they will be reassessed by the provider. If they still felt to be food insecure, then they would still have access to that food pharmacy.
All right, thank you. I just want to remind our viewers again that we are conducting a community survey, and we want to hear from you. We would love to get your feedback. Your responses will help us determine the community's priorities and which health services to bring to our Bordeaux Medical Center, as well as future services in the community. So you can either scan this QR code that's on the screen, or in the chat is a link that will take you directly to the survey. So thank you in advance for your participation. Back to our questions. So someone asked the question about whether Nashville General accepts volunteer services, and wanted to know what are the various ways that a community member can volunteer with Nashville General. I can actually answer that one. You know, with COVID, all of the in-hospital services have been suspended, as with other healthcare facilities across the country. But we do still have two opportunities where community members can assist us, and where we actually have a pretty strong need. So part of the food pharmacy also has a outreach program that provides food totes to community members who have been identified or who have self-identified as being food insecure, and not having access to the quality foods that are available at our food pharmacy. So individuals can help to deliver the totes and can also help to make the totes here on site. So those are two opportunities that are very important ways that we can continue to serve, and we can continue to utilize the services of volunteers who want to help us serve our community. So thank you very much for that question and for allowing us to share that opportunity with the public. Let's see. What will the hospital's relocations, how will the hospital's relocation affect its patients? Will Davidson County still be the service area?
Absolutely. That won't change. We will continue to be also the index teaching hospital for Meharry Medical College. The only thing that will change is we will go from our existing location, hospital, and structure here to a state-of-the-art facility, still serving the same population, but with a greater opportunity for expanding the volume and the growth and the development and generating higher revenues so that we can afford even more services to our population. Okay. And less cost to the taxpayers, by the way.
Yeah, that's a very, very good point. And as a follow-up, someone's asking, what would our goals be, our first year goals be for the new hospital financially? Nope, for the new hospital, financially speaking, I think. Or is this, sorry, what are our first year goals for the new Bordeaux location? Okay, I misunderstood the question. Mark or Bruce wanna take that?
I mean, I'm happy to answer it, Sherry. I mean, I'll try. It's similar. We modeled it after the Charlotte, the Midtown Clinic, basically. So within that first year, and it depends exactly when it opens, but we would expect the physician service side, the clinics, to, by the end of that first year, to be averaging 300 to 400 clinic visits per month. And as you guys know, at our offsite clinics, those focus on insured populations. We still have those services available here for the uninsured population, but our offsites are primarily focused on insured patients. So 300 or 400 net new insured visits per month. That's part of the business model of creating spokes off-site from the hospital. And we'll continue to do that even when we have the new hospital. So those won't change. The imaging center, I would have to defer to Mark on what his expectations are for net growth, because some probably will come from our existing at the hospital, but I know we expect growth.
Yes, we expect growth at that location because of the services that we'll be offering from an imaging perspective. So we're expecting probably just under shy of 5,000 new patients coming into our services for imaging procedures.
Okay. All right. Thank you. I did see a question. Excuse me. Somebody asked if our relocation means that we were moving away from Meharry, and exactly. Everyone's shaking their heads.
Yeah, I think
Dr. Webb, would you like to reiterate that point?
I did answer that question before you asked it, but I will reinforce that in the minds of all of our listeners that we have no intentions of not being the index teaching hospital for Meharry Medical College. But this would also allow us to provide relationship for teaching and learning with other allied health programs, as well as, some of the other medical students in the city. So certainly will continue to be the index teaching hospital for Meharry.
Okay. All right. The questions are starting to slow down. I don't see any more questions. I believe we've gotten to all of the questions that were asked this evening. So I am going to turn it over to Dr. Webb to close us out.
Sure, that's all. Not one more question. Just one more question.
Well, wait.
Twice. Come on.
Hold on.
Okay, there we go.
Oh, we did get another question. This is a good one. You're often referred to by many names: Metro, Meharry, and Nashville General. What's the hospital's official name?
I believe the hospital's official name is Metropolitan Nashville General Hospital.
Yes. Old habits die hard. So,
but we'll answer to some other names too.
That's right.
As long as you need help, call on us. Whatever you call us, we'll help you.
That's the perfect point to end on.
Yeah, we're here for the community. And with that, okay, so no more questions. I want to thank you all. I certainly want to thank this group that participated, our board chair, the community leaders that participated in putting their voices to this town hall, and certainly the leadership team here before me, and the work that you put into making this what I would consider a real success. And for those of you that tuned in and asked those questions, we appreciate you. We want to make sure we keep you informed. The things that we're doing here are oftentimes publicized in our newsletters, so we try to keep you informed that way as well. But this is kind of a culmination of the activities for the past year that we've engaged in, and the successes that we've had. We look forward to continuing to service your needs. We are the city's public hospital. We are the only public hospital in Middle Tennessee. No matter what anyone tells you, we are the only public hospital in Middle Tennessee. And I don't know if we stated our mission and vision to you today, just before we go. But I will give you the mission is to improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, teaching tomorrow's caregivers, and translating science into clinical practice. And I put emphasis on equitable care because that's a big issue in today's time with health disparities and a lot of the inequities that people experience under the social determinants of health. Our goal is to make sure that every individual is able to receive care, excellent care, and that is, as you know, the majority of our patients that come to our hospital do have the ability to pay at about a 60-40 ratio. So we have a lot of people that come here seeking care because of the quality. But we also make sure that that same quality is extended to those who cannot afford. And we have our cancer center that you heard about earlier. So we believe that the public hospital is essential for a community. This is the hospital of the people. And the will of the people is what's kept this hospital going for 132 years. So with that, I will say, if there's nothing else, good night, and thank you for joining us for this town hall meeting.